I'm happy to introduce a new way of rounding at the University of Florida for the Department of Medicine. We're going to introduce multidisciplinary rounds on the general medicine services, and I think that this is a great breakthrough. This is a model that's been experimented with over the past few years, and I think with input from faculty, from house staff, students, nurses, from the case managers, that finally we're at a point where this really is a best practices scenario for the way we round. Why should we be doing multidisciplinary rounds? Well, I think the more input on any patient that we have, the better the care for that patient. So if we're involving nurses and the case managers, the pharmacists, in addition to all of the medical expertise that comes with the usual rounding team, then that patient's going to get much better care than they otherwise would. I think it also improves morale on the floor. I think getting to know the nurses will be a great thing for the house staff. It'll create a nice esprit de corps on the services as well.
And I want to introduce you to the basic principles of multidisciplinary rounds, which we call Gatorounds. And there are three basic principles. First of all, playbooks. Everyone needs to know what they're supposed to do, when they're supposed to do it, and where they're supposed to be working. Too often in medicine there's ambiguity and everybody assumes the other person has that job. The second key principle is who's passing and who's catching. That is effective and efficient customer-supplier relationships. One of the most important customer-supplier relationships is that of doctors giving orders to nurses. And nurses are the customers in this case, and they need to understand very clearly what the management and diagnostic plans for each patient are. In that way, if they understand those, they will not be paging the house staff because they will be on board and they will be understanding, have a very clear understanding of what's going on with their patients. The third, and I think the most important principle, is that of game films. That is, each day, at the end of rounds, the team should gather together and ask the specific question, what went well today and what could be improved? In this way, just as coaches go over performance, the team can go over their own performance and make continual improvements and make their system more and more efficient and more effective. Now, the other key element of Gatorounds is understanding the fundamentals. And those fundamentals, in the case of multidisciplinary rounds, are very efficient communication and understanding how to give a very succinct and accurate SOAP, subjective, objective assessment plan, and also in cases where there's an unexpected change, SBAR, situation, background, assessment, and recommendations. And finally, in presenting new cases, rather than giving an excessively detailed history, house staff and students are encouraged to give the highlights, the key points in history, the key points in physical findings, the key points in laboratory data, and then to focus on problems. That is, and this is true of the SOAPs presentations as well, present each problem specifically, and then what's the differential diagnosis, what is the working diagnosis, what are the diagnostic plans, and what are the therapeutic plans for that particular patient. In this way, we will save a great deal of time and not be presenting for long periods of time out in the hallway. And whenever possible, all team members should present in the room and include the patient and the patient family as part of the team. The other key element, in order to involve our nurses, which are very important because they are the front line of care, we want to arrive at specific floors at relatively consistent times so that the nurses know when we are going to be there, so they can have their workflow organized so that they can actively participate in our workarounds. And what we want to do in creating a very good multidisciplinary team is to create a team spirit and a sense of belonging that will bring joy to work.
One of the other things that I think is going to be very important coming out of this best practices standardized rounding schedule is that everybody on the team will know what their particular task is and what the expectations are. And I think this will carry over into the other ways that we conduct our services, not just on the medicine subspecialty services, but when we go on to the specialty services and when we do all other types of consultative services, that this will carry over. So I look forward to this as being a great advantage and a great advance in the way that we do our inpatient services. I think also, on a practical note, that this is going to eventually save time. I think that limiting these rounds to 2 hours of the actual rounding time is going to make way for the other important things we have to do during the daytime. So I fully expect and anticipate that you'll do a total buy-in to this. Thank you.